healthcare workers in Zimbabwe have temporarily ended their strike over salaries. Union leaders are warning that they will resume that strike if government fails to make an improved wage offer within 2 weeks. Let's speak about this with James Sibanda from the Health Apex panel. He's deputy team leader there. James, good to have you on the program. Have negotiations resumed now?
Good afternoon to you. It's unfortunate that so far we haven't yet tangible negotiation. We only have one that was last week on Monday, which resulted in nothing tangible coming out, and we are still waiting for the government to call us and have the negotiation to come up with something for us.
Given that then, that there's been no discussion, as you say, in the latest days, how confident are you that in 2 days, or 2 weeks, I beg your pardon, there'll be an offer that is satisfactory to workers from the government?
It's not like we are confident in it. We are not confident at all. But there are other factors that we have considered. So you see, we have got innocent people, innocent patients out there whom we want to serve. So it's only a matter of two sides of a coin. As much as we want money, we want a living wage. We can't stay away from the job for too long because there are innocent souls that are going to perish. So we told ourselves it's better we attend to our patients while least giving our employer and olive branch a benefit of doubt to see if they can do something for us.
So you've gone back to work for the sake of your patients. In 2 weeks, if there's no offer, will you go back to striking?
Yeah, the chances are high that we will go back. We don't want to call it a strike per se, but we want to call it incapacitation. We want to call it incapacitation because for all along we've had low wages, but we are still working. Not to say we're getting good wages, but we were able to go back to work and save our patients. Unfortunately, we reached a point whereby we couldn't go back to work.
So
in the next 2 weeks, if the government doesn't give us anything, the chances are high that we are going to be incapacitated again.
On that then, for the benefit of people listening to you and I speaking from South Africa and other parts of the continent and people who will possibly view this conversation later online, I was reading that the salary for nurses in Zimbabwe, when converted into US dollar terms, sits somewhere around $53 a month. You mentioned the idea of a living wage. What would a living wage be today for health workers in Zimbabwe?
I think something above 1,000 USD is enough for a living wage. It's a line that is above the over-datum line.
And can the government
Unfortunately
afford that?
for now, sorry?
Do you think the government can afford that, given Zimbabwe's current economic situation? I mean, inflation is soaring and the economy continues to be in free fall.
Yeah, we have got a feel that given all the efforts, or putting all the efforts to the health sector, the government can afford that. It's very, very possible.
I'd like to go back to what you're talking about on the issue of how much a living wage you think should be. You said around $1,000 a month. Let's talk about what it's like to be a healthcare worker in Zimbabwe now with the salaries that you're earning. How difficult, how tough is it?
I don't want to lie, wages are not enough. Things are hard for the health worker. But it's a situation whereby we are telling ourselves we need to work hard for our patients. We need to work hard for our people. Otherwise, we'll be left with nobody to look after them.
What about leaving the country to pursue opportunity elsewhere? Are any of your colleagues thinking of leaving the country? Are they leaving now to go work somewhere else just to be able to feed themselves and their families?
Yeah. We have got a lot of friends, especially in the health sector. As for now, for the past 2 years, I think we can talk about around 4,000 health workers. We have left the nation going for greener pastures. And others are actually processing their papers to get out of Zimbabwe to go and look for greener pastures, which is a situation that we are saying it's not good at all for the health sector in Zimbabwe.
James Sibanda, good to have your time. I will leave it there. I see someone is quite desperate to speak to you there. For now, thank you so much for your time.